Heart disease is often called the silent killer, not because it always strikes suddenly, but because it builds slowly, quietly, and dangerously beneath the surface, with many people having no clue that their risk is rising day by day. So in this video, let's dive deep into 10 silent factors that increase your heart disease risk without giving you any obvious symptoms. First, let's talk about high blood pressure, one of the most dangerous yet symptomless conditions. Many people walk around with elevated blood pressure for years, not feeling a thing, while the constant pressure damages arteries, strains the heart, and silently prepares the ground for heart attacks or strokes, which is why regular monitoring is essential even if you feel completely fine. Second, chronically high LDL cholesterol quietly builds plaque inside your arteries like slow-forming cement, narrowing the space for blood flow and creating conditions where clots can form. You may feel energetic, pain-free, and normal, yet inside, your arteries may already be stiffening and thickening. Third, high blood sugar levels, even borderline or pre-diabetic ranges, can harm the inner lining of your blood vessels, encouraging inflammation and plaque formation, and this often happens without any visible symptoms until significant damage is already done. Fourth, chronic inflammation in the body, triggered by stress, poor sleep, processed foods, or autoimmune issues, can silently damage blood vessels. Inflammation acts like rust inside your arteries, weakening them slowly over time. Fifth, visceral fat, the dangerous fat around your organs, can increase your risk even if you appear thin from the outside. Someone can have normal weight but high internal fat, which produces inflammatory chemicals that directly harm heart health, and because you can't see or feel this fat, it often goes undetected. Sixth, sleep disorders like sleep apnea are commonly ignored because people assume that snoring is harmless. But every pause in breathing puts pressure on the heart, spikes blood pressure, and reduces oxygen supply, gradually straining your cardiovascular system without symptoms during the day. Seventh, chronic stress pumps continuous waves of cortisol and adrenaline into your bloodstream, tightening arteries and raising heart rate. While you may feel you are managing your stress, your heart often pays the hidden price. Eighth, a sedentary lifestyle is one of the biggest silent risk factors. Even people who go to the gym but sit all day may experience stiffening of arteries, poor circulation, and rising triglyceride levels. Inactivity chips away at heart health like slow, invisible erosion. Ninth, environmental factors such as pollution, especially fine particulate matter, silently irritate your lungs and bloodstream, causing inflammation that increases the risk of heart attacks and strokes. This damage accumulates over time without obvious symptoms. And finally, 10th, family history is one of the most underestimated silent risk factors. Even if you feel perfectly healthy, your genetic makeup may predispose you to cholesterol issues, hypertension, or early heart disease, meaning your heart may require earlier monitoring and more proactive care. These 10 hidden risks are especially dangerous because they progress quietly, giving no outward warning signs, which is why regular screenings, mindful lifestyle choices, stress management, high-quality sleep, clean eating, consistent exercise, and professional cardiac evaluations are essential. By understanding these silent threats, taking timely preventive steps, and staying informed, you can dramatically lower your chances of heart disease and improve your long-term health. Remember, heart disease rarely begins with chest pain. It begins with slow, silent changes inside the body that can be identified and controlled early. So take charge, stay aware, monitor your health even when you feel perfectly fine, and prioritize your heart every single day to live a longer, stronger, healthier life.